Howdy everybody, this is Bryce Stubbers. Today, talking about knee pain. You go hiking a lot, you're getting your steps in, but thing is, maybe your knee is starting to feel some tension if your exercise is to walk a lot or to hike a lot. Walking and hiking are fantastic exercises to counteract the negative side effects of doing too much yoga asana. Yoga asana develops the smaller muscles, the rotators of the hip, while it tends to leave out the larger muscles such as strengthening quads and hamstrings. So walking helps to activate the larger muscles, glute max, hamstring, quadriceps. So it's a perfect counteraction for doing lots of yoga asana. But you do too much of a good thing, it comes with a cost. So a lot of times people who walk a lot, they start getting some pulling in their knees. If that's you, we're going to talk about it. Harihi Om. Harihi Om, everybody. So, a lot of times, people get a pulling at the very top of their knee because the quadricep, especially the centermost quad, comes down, it covers the patella, and attaches to the tibia. So, anytime you've got this pulling sensation, either in the center, the inside, or on the outside of your knee, most likely because you've gotten too strong too quickly from either walking or hiking, running. And like we've been talking about with all these other videos, when a muscle gets too strong too fast, the end points of the muscle get pulled towards the center. And so the center of the muscle gets too thick too fast, and it loses its elasticity. So the end points, one or the other, tends to start moving too much. Those are the tendons. And so that's how we tend to, that's how our tendons tend to start showing up like joint pain. Even though there's nothing wrong with the joint, there's an injury starting to take place where the muscle attaches to the joint. Tendon doesn't get much blood flow, so it takes a long time to heal. The cause is the center of the muscle, and the main treatment is massage. Your hands, somebody else's hands, ball, all very good options. But the key is you want to dig around until you find exactly where those knots are. If you have the pulling on the outside of the leg, you want to follow that line up the outside of the leg. Maybe it's coming from the IT band. Maybe there's a bunch of knots in glute medius or in TFL, tensor fascia lata. It's not a drink at Starbucks. Or if it's in the center of the knee, maybe it's coming from the very center of the quad. If it's on the inside of the knee, maybe it's coming from the inside of the quad, the inner thigh. So get yourself a ball, lay on your stomach. You're going to start rolling side to side and up and down. And don't spend too much time where the pain is. You want to use that as a reference point, and you want to go up. So you don't really want to massage the tendons, even though that's where the pain is. The natural impulse is to go right there, but that's how you can actually make this situation worse. If you massage a tendon that's already starting to micro tear or pull, it might continue to make it too elastic. So we want to use that as a reference point, follow the map deeper into the territory of the muscle, and you'll feel these thick, dense little pockets with a lot of sensation. That's the place where you feel the density. That's the place to lean in with the ball, where the buried treasure is. And guaranteed, as you start to smooth out where that buried treasure is, higher up inside the musculature, the pain in your joint is going to gradually start dissipating. Don't take my word for it, give it a try, but don't just try it once. Practice consistently for a few minutes, for at least a week, maybe even a month. After a month, you're going to notice a huge difference. And so this is a great way to prevent a lot of unnecessary surgeries and slow down an eventual joint replacement or even prevent joint replacements. But again, don't take my word for it, just give it a shot. So lay on your tummy. Okay, from your stomach, take the ball about 1 inch or 2 centimeters above the knee, bend the knee, lift the foot off the floor, and start rotating side to side. So you create a rainbow shape around the contour.
And if you have more pain on the inside of the knee, take the leg out to the side and gradually work up the inside of the thigh. If you want to get more weight or more pressure on the leg, you could put the ball on top of a yoga brick to get more pressure. And you just gradually work your way all the way up into the groin. Wherever it feels the most dense, spend your time there. If it's the majority of your pain is in the very center of the quad or the center of the knee, you just kind of stay in that center area. Keep working your way upward until you find a very thick kind of guitar string or like a speed bump. Once you find a spot, you can lean into it, do tiny movements or broad movements. Play around. You gradually work your way all the way up into the groin and spend a lot more time than I'm doing right now. This is just a demonstration. But for you, you might need to spend 5 minutes, 10 minutes even. If it's more on the outside of the leg, the outside of the knee, in the IT band, you can roll onto that outside corner, bending the opposite leg, using the opposite leg as leverage, to then lift the foot off the floor of the leg you're massaging and start rolling side to side, kind of on the corner of your leg and the outside of the leg. And gradually take it up. Wherever you feel that buried treasure, lean in. As you keep going up this IT band and the outside of this leg, you're going to get to a point where the tissue is getting so thin, you're just getting really close to the outside of your leg bone, the greater trochanter. So you want to skip that area and instead take the ball pretty high around your waistline, just below the pelvis, to the squishy spot on the outside of your hips, above the hip joint, above the greater trochanter. You roll onto the outside of your hips. This is glute medius. And you can also take it a little bit around the kind of corner of your pelvis to get the TFL, tensor fascia lata, which is what the IT band connects to. If you got pain on the outside of your knee, this whole area can really benefit from some exploration.
Okay, everybody. Hope this is helpful, useful for you with your healing process. Wherever you're at, please like this video. Reach out if you have any questions or concerns. We've got regular online yoga classes as well as retreats worldwide. Please reach out if there's ever anything I can do for you. Hope you have a wonderful day. Hariom.